In terms of incidence among both sexes, ahead of it only breast cancer and lung cancer. Despite the fact that colorectal cancer ranks third among men in terms of the number of new cases per year, and second among women, men develop colorectal cancer more often than women. In the United States, for example, men are 25% more likely to develop colorectal cancer than women. Mortality from colorectal cancer remains at a high level in the world and ranks second among other malignant tumors, second only to lung cancer. Despite such high rates, mortality has been gradually decreasing in many developed countries in recent years. However, in Russia, colorectal mortality rates have remained stable in recent years. Only the mortality rate from rectal cancer is slightly reduced. The likelihood of developing colon cancer increases with age. However, in recent decades, there have been increasing cases of colon cancer developing in people under the age of 50. In the United States, the risk of developing colon cancer before the age of 50 increased by an average of 2% per year from 1996 to 2016. Colorectal cancer occupies one of the leading places in terms of morbidity among other malignant tumors. Men get colorectal cancer more often than women. Mortality from colorectal cancer remains at a high level and ranks second in the world among other malignant tumors. The likelihood of developing colon cancer increases with age, but recently the proportion of colorectal cancer patients under the age of 50 has been increasing. With hereditary tumor syndrome, mutations are transmitted from parents to a person that increase the risk of specific types of cancer during life. There are many inherited mutations that increase the risk of colon cancer. There are so many of them that separate groups of hereditary tumor syndromes have been identified. In the case of colon cancer, hereditary tumor syndromes are of two types: hereditary polypus colon cancer, hereditary non-polypus colon cancer, or Lynch syndrome. There are differences between them in how exactly the disease occurs, how it can be treated, and what other diseases can accompany colon cancer. How to understand if there is a risk of colon cancer in the family. It is impossible to do this without episodes of cancer. The possible risk of hereditary colon cancer in the family is indicated by the following circumstances, if they combine with each other: the presence of colon, endometrial, ovarian, stomach, small intestine, ureter, renal pelvis, biliary tract, pancreas, malignant neoplasms of the brain, glioblastoma, skin, at least 3 relatives, including one closest, mother, father, brother, sister. The presence of the above diseases in 2 consecutive generations, mother, grandmother. In at least one case, the above diseases were diagnosed before the age of 50. It is important to understand that these criteria only indicate the possible risk of cancer in other family members of the patient. What to do if there have been cases of colon cancer in the family? The presence of one or more of the above criteria is an indication for a colon cancer patient to consult with a geneticist. It is also a reason for genetic testing to look for Lynch syndrome. If genetic testing has not been performed, the patient's relatives should have a colonoscopy every 1 to 2 years, starting at the age of 20 and over the age of 40 annually. Relatives of the first degree of female kinship, daughter, should be examined annually for endometrial and ovarian cancer. How to detect hereditary colon cancer. The methods of diagnosis of colon cancer and hereditary syndromes are the same as in non-hereditary cancer. If the hereditary nature of the resulting adenoma or colon cancer is suspected, molecular genetic testing is indicated to detect mutations. When there is a combination of factors that cause suspicion of hereditary cancer and the corresponding mutations, a hereditary tumor disease is diagnosed. Every 10th case of colon cancer is associated with hereditary mutations. Hereditary mutations are stable changes in DNA that are inherited from parents. Variants of hereditary colon cancer include Lynch syndrome and hereditary polypus cancer. Hereditary mutations increase the risk of colon cancer and other neoplasms during life. Cases of colon cancer in the family, at least 3 cases, one of which is a close relative, as well as those that occurred earlier than the age of 50, serve as a reason for genetic counseling and an earlier start of screening. The methods of diagnosis and treatment of hereditary colon cancer are similar to the principles of managing patients with non-hereditary cancer. In patients with Lynch syndrome, immunotherapy can be effectively used at a certain stage of treatment. How does colon cancer manifest itself? The most common symptom is stool disorders such as constipation or diarrhea, frequent loose stools, lasting for several days or more, unrelated to other causes, diet disorders, hemorrhoids, intestinal infection. According to statistics, stool disorders occur in 7 out of 10 patients with colorectal cancer. A tumor in the intestine creates a mechanical obstacle to the free passage of feces, which is why constipation is associated. The tumor may also be accompanied by a feeling of fullness and a need to empty the intestine, which, however, does not go away after defecation. Prolonged mechanical obstruction of the passage of feces can lead to intestinal obstruction. It is accompanied by abdominal pain, nausea, and vomiting, and is a life-threatening condition requiring immediate hospitalization in a surgical hospital. Another group of symptoms is associated with bleeding from the tumor. It is accompanied by the appearance of blood in the stool or a change in its color, darker than usual up to black. In medical parlance, the term tar-like feces is used to refer to the color and consistency of feces during intestinal bleeding. Prolonged blood loss is accompanied by symptoms of anemia. These include general weakness and fatigue, pale skin color, rapid heartbeat, and shortness of breath. Anemia is also often detected as a result of a routine general blood test. Tumor bleeding and anemia syndrome are characteristic of tumors of the ascending colon. A colon tumor can manifest as abdominal pain and discomfort. Another symptom of colon cancer, like many other tumors, is unmotivated weight loss. Can colorectal cancer be asymptomatic? Up to 90% of colon cancer is diagnosed against the background of complaints, and an asymptomatic course is often found. The tumor may not reach a large size and may not cause stool disorders. Also, bleeding from a tumor can be so insignificant that it does not manifest itself in any way and is detected only when taking a general blood test or undergoing screening, stool analysis for hidden blood. Due to the asymptomatic course, colorectal cancer is often detected at a widespread metastatic stage, which leads to a worse prognosis. At the same time, the appearance of symptoms is often associated with a later stage of cancer. Therefore, it is extremely important to undergo periodic screening, especially in the presence of risk factors. Colorectal cancer screening does reduce mortality. By far the most effective method is colonoscopy. Immunochemical examination of feces is promising. Patients with genetic tumor syndromes are at high risk of developing colorectal cancer. They need to be screened more often and start at an earlier age. As part of the adult medical examination program, fecal analysis for hidden blood should be given to people from 40 to 64 years old every 2 years, and from 65 years old annually. Are there ways to reduce the risk of colon cancer? The main way to reduce the likelihood of colon cancer is to control the risk factors that can be affected. One of the ways to control this is to perform a colonoscopy, which is part of the screening program. This study by itself does not reduce the risk of getting sick, but it allows you to detect and remove polyps in time, which are a risk factor for colon and rectal cancer. Their removal reduces the likelihood of a tumor disease by almost 2 times. Does lifestyle change help? Overweight people get colorectal cancer more often. Controlling body weight and obesity can reduce the likelihood of developing malignancies in the colon. Physical activity. Regular physical activity reduces the risk of colorectal cancer. Maintaining the recommended intensity of physical activity, 150 to 300 minutes of moderate intensity, or 75 to 150 minutes of high intensity per week, also reduces the risk of melanoma, breast cancer, uterine body, and other malignant tumors. Smoking. This is one of the main risk factors for many cancers, including colon cancer. Quitting smoking helps to reduce the likelihood of developing it. A diet dominated by vegetables, fruits, and whole grains reduces the risk of colorectal cancer. Although the role of dietary fiber is not yet fully understood, studies show the negative impact of frequent consumption of red, pork, beef, lamb, etc., and processed sausages, etc., meat on the risk of tumors in the colon and rectum. However, it is difficult to assess the role of red meat alone in the development of colorectal cancer, regardless of other risk factors. There is no convincing evidence that reducing its consumption will lead to a lower risk of getting sick. A full and varied diet, such as the Mediterranean diet, helps reduce the likelihood of dying from a malignant disease, including colon cancer. Colorectal cancer. Colorectal cancer. Although the role of dietary fiber is not yet fully understood. 1722. Studies show the negative impact of frequent consumption of red, pork, beef, lamb, etc., and processed sausages, etc., meat on the risk of tumors in the colon and rectum.